Hello, this is Chris from the Obstacle Doc, and today we're going to talk a little bit about soft tissue mobilization to the shoulder girdle using a lacrosse ball or a tennis ball as one example. There are other gadgets we can definitely talk about and utilize, but this is a nice little quick algorithm to get to key muscles in the back of the shoulder girdle as well as in the front of the shoulder girdle. Just like anything else we talked about with soft tissue mobilization, as a disclaimer, this is not a be-all, end-all. It's not a magic bullet. A lot of times we need to peel away the layers of the onion to understand why things are getting tight, not just doing these as our remedy. But in the short term, they can help us with mobility deficits, flexibility, stiffnesses, to help and allow the client to improve mobility, improve their patterns, just understand how to move a little bit more clean, as well as a little bit of pain reduction too. But again, this is never going to be by itself. Usually we're going to add something with this because everything's a combo. It's never one over the other. So keying in on the posterior shoulder girdle, there are two key areas that we want to talk about. The deep rotator cuff areas, specifically the external rotating muscles referred to as the infraspinatus and the teres minor. And then we're going to come down a little bit lower to a big group of musculature, your lats and your teres major. These two muscle groups will help to restrict motion internally, cutting across our body and going overhead. And the lat will also restrict external rotation. So they really, when they bind in, can tighten up a lot of the movements of the shoulder girdle. So how to get to these from the back? Everybody has a nice, hard, bony line on their shoulder blade. If I reach across with my offhand, this is referred to as the spine of the scapula. I'm going to take the ball that I'm going to use. I'm going to place it on the spine of the scapula, and I'm just going to roll it down into the soft tissue area slightly below. Then, coming to the wall, I'm going to place that arbitrarily against the wall, leaning with enough pressure that the ball isn't going to go anywhere. And now I'm kind of in my position to target the infraspinatus and the teres minor. So as I move millimeters up, down, left, right, I'm going to start to find areas that are a little bit more sensitive, a little bit more tender. I'm probably now on a trigger point in one of those two muscles, and now I'm going to start treating it. In order to treat this muscle, to try to help to get a temporary release, we want to hold that ball pressure for about 45 seconds. Physiologically, it takes around that time for the muscle spindles within the muscle itself to want to try to promote a release to that muscle. We can do this passively and just kind of be on it. We can also do a technique or an active release strategy, whereas we can do active movements while we are maintaining our ball pressure. So for example, I can hold that pressure as I go into active shoulder flexion. I can work on shoulder rotation, and I can go across my body into horizontal adduction. All three are applicable. If we have a client who has tightness in one of those three directions, we might want to go into that one more. They're not meant to be forced. It's just nice mid-range movement to try to get a release to the area. Moving down to the lats and the teres major, we're going to come now from underneath the armpit, and it's kind of this thick, meaty area. Now, we're catching a portion of the lat. The lat spans the whole side of the back. It kind of tucks in like a shirt. So we're going to use this ball to get kind of to the upper lateral fibers. So coming underneath the armpit, I'm going to place the ball, and again, I'm going to wedge into the wall so that it doesn't go anywhere. And then once I'm there, I'm going to roll around, yep, right there, and I'm going to find a nice tender spot. I'm probably on that trigger point that I'm looking for. And again, similar parameters, 45 seconds to hold. I can also go into active release strategies, similar to before, to try to get a little bit more tissue release as I hold that ball pressure. Now moving to the front of the shoulder girdle, we're going to really target the pec, the chest wall area. So pec major, pec minor. This is one really generic way to kind of get to this, but the idea behind it with my lacrosse ball, I'm going to start out wide. I'm going to bend my elbow, and I'm going to place it arbitrarily right here in the chest. From that position, I'm going to come over to the wall, and I'm going to wedge it between me and the wall. And again, as I'm moving up and down, left and right, I'm going to catch a tension spot on the chest wall, and now I'm going to start to treat. 45 seconds, passively, or if I have enough clearance in my shoulder, I could go into like a goal post and work an active release, almost like a dynamic door frame stretch as I'm applying that pressure into the chest wall. As an alternative to the ball strategy with the lat muscle, you can use a foam roll as well on the floor. So the way this one works, foam roll is going to be down. If I'm targeting my right lateral aspect of my lat muscle, I'm going to take that back part of the armpit and I'm going to let it rest on the foam roll itself. This arm's going to be nice and relaxed. I'm going to use my offhand and my legs to kind of steer. Now, keep in mind, this is actually pretty sensitive because we have a lot of weight on this, so you don't need to really like force much, but using my body to steer, I'm going to roll kind of up and down the upper part of that back of the armpit and rib cage area. If I want to catch the really side of the fibers, I'm going to stay perpendicular to the floor. If I want to lean back a little bit, I can catch a little bit more of the medial or kind of inner fibers of the lat by opening up my body just a little bit more and rolling. Again, similar parameters apply. Once I get a spot that's pretty tender, I'm going to stay on that for about 45 seconds. I can breathe with it. I can do a little bit of active release depending on, again, clearance of your arm with the floor as I hold that tension spot. Again, alternative to the ball strategy on the wall, you can use the foam roll for the lats.